So let's start out with the median nerve. As Evangelos explained, it comes down and we're talking about the neurovascular sleeve, and then we start to get farther down. We start to look at different areas where the median nerve comes through. Ulnar nerve on the inside, innervating fingers 4 and 5, the median nerve coming down, and then the radial nerve on the outside. In terms of the median nerve, we know that it comes down and actually passes in between the biceps brachii and the brachialis. So one of the first things to do is probably just loosen this up a little bit here. Take this out and just loosen that up a little bit. Turn your head over to the other side there. Not too bad?
No.
Okay, now take it back to center. Your head back to center. Now bring your head over to the other side. Rotate it to the left. No, to the left now. There we go. I'll try to be a little more articulate with my instructions. Take it down. Good. Now we get part way down here and we start getting to the base of the biceps. The literature shows that we have a little notch in here where the ligament of Struthers can come along and actually entrap the median nerve a bit. So we actually may want to work our way up along the bone there a little bit. Get in there. You okay?
Yeah.
And then kind of work in and then kind of free it up a little bit. That's a little tight there, isn't it?
Yeah.
And then we want to get down near the elbow here, and the median nerve goes through a little area called the cubital fossa. So we'll get in there and kind of free that up a bit. Now, there's a really interesting thing. If we look at the anatomy books, we're going to see great variation in terms of where the fascia crosses, how the ligaments actually connect. Are you okay?
Yeah.
Good. So you want to kind of move around and make sure we're feeling the area. And the key thing to releasing nerve entrapment syndromes is not to really speed up that much. Now, as we work around here, we're going to find the Pronator Teres, double-bellied muscle. In the middle of that, in most cases, the median nerve goes through the center. Now, if I'm palpating in here, I can easily find that. You feel a little spot right there?
Yeah.
Okay, so if we find the median nerve there, that's kind of like uncooked linguine or al dente. So if I get right on that spot around there, and I can kind of roll my finger in, take this down. Now I want you to actually look and rotate your head over to the other side. And I'm just going to kind of move this around a little bit here. Now bring it back center. Take this here, and then take your head over. Do you feel that tension really increased right there?
Yes.
Right at that spot. It's amazing,
Yeah.
actually, how you get that tension all the way down through the shoulder, the neck, the brachial plexus, cervical plexus. And now I'm just starting to feel it move a little bit through there. Now, of course, we can do all sorts of pin and stretch stuff here, just some of the standard stuff for loosening this up. Push against me a little bit there. Push against me. Good. Just to free that up a little bit in the forearm. Good. Take this down. Right down. Push again. Good. These are some pretty standard pin and stretch procedures which cross a lot of different treatment modalities. Good. Down. Now, here's the key thing. We're going to get up around the wrist, and we're going to work in the other direction. So you should open your hand and just make a fist here. Not too fast. I'm going to get you to do that again, but I'm going to go on the inside of the carpal tunnel here, kind of open that up a little bit and bring it in. Do you feel that kind of opening up in there? And back, open up again. We really want to take our time here, and again. But there's a lot of branches that come off the median nerve that I just want to make sure the hands themselves are actually fairly mobile. So while we're here, we might as well actually get some mobility, work down the fingers, open up a few joints. It's all good. There we go. We'll work our way down there. Now, I'm going to get in here and I'm actually going to palpate until I can find that feeling of a nerve and fairly deep. Now what we're going to do, don't traction down, just get in deep, hold it, and pull this back. Are you okay there?
Yeah, that's good.
And it's almost like you feel the structure underneath your hand popping up. And I'm going to go medial and lateral to that. That's a bit tight. And let me move over a little bit there. Good. Take it down and hold it. Okay. Now, again, take it down, hold it. You okay? And again, take it down and hold it. All right, now I'm going to actually take the arm here. And what I'm going to do is I'm going to get you to turn your head. When I ask you to, now take it over to the other side, rotate over. the left. Feel that?
I sure do.
Okay, now bring your head back center. Now do you feel how that tension just came right off there completely?
Yeah.
Okay, and again I'm going to straighten this out here. This time I'm actually between the Pronator Teres. Take that over, your head over there. Good. Good, good, good. And hold. Okay, so what we're doing is we're working all the way from the neck all the way down, and we get to certain points of common entrapment. The research is well documented for decades in terms of common spots of median nerve entrapment, and there's lots of good objective research to back this up. Pronator Teres is a very common one, Ligament of Struthers, and obviously the carpal tunnel. And what's interesting though, a lot of times people will come in and they think they have carpal tunnel syndrome, but the pattern isn't quite right. And if we have entrapment anywhere along the entire length of the nerve, we'll notice that we'll get exactly the same symptoms. So there's a lot of misdiagnosis when it comes to peripheral nerve entrapment. Okay, so from here let's move on to the ulnar nerve.